If you're taking Prozac for anxiety or depression or thinking about it, there are 10 things you need to know. Weight gain, sexual dysfunction, fatigue, and difficulty sleeping are some of the side effects of Prozac, but we also know it can be life-saving for some people. According to an African proverb, the medicine that heals the head should not poison the stomach. Millions of people take Prozac every day to help with their mental health. But how exactly does it affect them? So let's talk about 10 critical facts about Prozac you need to know, including the surprising connection between this medication and your metabolism. Plus, I'll reveal the one timing mistake that makes your anxiety worse, not better. Hi, I'm Dr. M, an integrative psychiatrist and lifestyle physician. 3 months ago, Sarah walked into my office. 49 years old, taking Prozac for 2 years, her anxiety was better, but she had gained 23 pounds. Her libido had vanished and sleep was almost non-existent. I feel like I traded one problem for 3 new ones, she told me. Sarah's story isn't unique. It's the reality of thousands of perimenopausal women who don't understand how Prozac really works in their changing bodies. Today, I'm breaking down the 10 things every woman over 40 needs to know about Prozac, because knowledge is power, and you deserve to make informed decisions about your mental health. Let's start with what Prozac actually is. Number 1. Prozac is fluoxetine. It belongs to a class of medications called SSRIs, selective serotonin reuptake inhibitors. Think of your brain like a beautiful garden that requires constant care and attention. Serotonin is like water flowing through irrigation channels, nourishing different areas. In anxiety and depression, this water drains away too quickly before the plants can absorb what they need. Prozac acts like a dam system. It slows down the rate at which water flows out, keeping more available to nourish your brain's garden. More serotonin usually means a better mood and less anxiety. But here's what's fascinating about perimenopause. Number 2. Your changing hormones affect how Prozac works. During perimenopause, your estrogen levels fluctuate wildly, high sometimes and low other times, like a roller coaster. Estrogen influences how your brain interacts with serotonin. When estrogen levels drop, your brain may become less responsive to serotonin. This means Prozac might not work as effectively as it did in your 30s. A study found that women in perimenopause often need different dosing strategies compared to younger women, yet most doctors prescribe the same way for everyone. If you're deriving value from this video, consider subscribing to our channel so you don't miss out on future educational content. Number 3. Prozac does not work immediately. It takes some time. Most women notice improvements in their sleep first, usually within 1 to 2 weeks. Improved appetite and energy can occur within this period. Mood changes typically occur around 4 to 6 weeks. But the full benefits, that can take up to 12 weeks. The mistake I see women make, giving up too early because they don't feel dramatically different after 2 weeks. Number 4, the weight gain connection. Here's the truth. Prozac can cause weight gain for some women, but it is not very common. In fact, this medication has one of the lowest risks for weight gain among antidepressants. Long-term studies show that only about 6 to 7% of Prozac users report noticeable weight gain, which is much lower than for medications like paroxetine, Paxil, where over 25% may gain weight. Most people actually lose 1 to 2 pounds during the first months of taking Prozac, likely due to appetite suppression linked to the medication and depression itself. Any weight gain after a year of Prozac use averages about 3 to 7 pounds. Among people who do gain weight on Prozac, this is more likely to happen if their appetite was very poor before treatment and then normalizes as their depression improves. In summary, most people do not experience a substantial weight gain on Prozac. If weight gain does occur, it is much less common than with other SSRIs. But for perimenopausal women, things are a bit different. You're already fighting the metabolic changes caused by declining hormones. Your insulin sensitivity is decreasing. Your muscle mass is declining. Weight gain may be more pronounced as a result of all of this. But there's another very concerning problem that affects nearly half of all women taking Prozac. Number 5. Sexual side effects. Up to 40% of women on Prozac experience sexual dysfunction, decreased libido, difficulty reaching orgasm, difficulty with arousal. During perimenopause, your testosterone is already declining, your estrogen is fluctuating. Adding Prozac can significantly impact sexual function. I've seen marriages strain under this pressure, women feeling broken, partners feeling rejected. But here's what's heartbreaking. Many women think this is just a part of getting older. It's not. It's often a side effect of medication that can be addressed. Number 6, Prozac interacts with supplements you may be taking. St. John's wort is the big one. This popular mood supplement can cause dangerous serotonin syndrome when combined with Prozac. But there are others. High-dose fish oil can increase the risk of bleeding. Certain probiotics may affect how your body processes the medication. Even something as simple as grapefruit juice can alter Prozac levels in your bloodstream. Always tell your doctor about every supplement you're taking. Number 7, the timing of your dose matters. Doctors generally recommend taking fluoxetine in the morning because it can be activating and may cause sleep disturbances for some individuals. However, for a small number of people, Prozac can actually make them feel drowsy or tired instead of alert. If Prozac makes you feel sleepy, it is safe to take it at night. But here's the mistake that could be making your anxiety worse instead of better. Number 8. Missing doses creates a roller coaster effect. Prozac has a long half-life compared to other antidepressants. This means it stays in your system for a longer period. But during perimenopause, your body processes medications differently. Stress, poor sleep, and hormonal fluctuations can all affect drug metabolism. Missing doses can trigger withdrawal symptoms, brain zaps, dizziness, increased anxiety. Consistency is crucial. Set phone reminders, use a pill organizer, whatever it takes to maintain steady levels. Number 9, coming off Prozac requires a specific strategy. Prozac is not addictive, but your brain adapts to its presence. Stopping suddenly can cause discontinuation syndrome. Symptoms include dizziness, flu-like feelings, brain zaps, and increased anxiety. For some women, this can last weeks. The good news is that Prozac's long half-life makes withdrawal easier than other antidepressants, but you still need a gradual taper under medical supervision. Never stop Prozac cold turkey, even if you feel better. Work with your doctor to create a safe plan for discontinuation. Number 10. Prozac works best as part of a comprehensive approach. Here's what I've learned from treating thousands of perimenopausal women. Medication alone is rarely the complete answer. Prozac can be a valuable tool, but it works best when combined with lifestyle interventions. Regular exercise boosts the effectiveness of antidepressants significantly. Omega-3 fatty acids support brain health. Magnesium helps with sleep and anxiety. Addressing inflammation, balancing blood sugar, and supporting your gut microbiome can all enhance the benefits of Prozac. It is essential to look at root causes. Optimize nutrition, support sleep, and stress management. This integrative approach allows you to use lower doses of medication while achieving better results. Speaking of feeling like yourself again, there's another medication that many women in perimenopause are prescribed for anxiety. You definitely want to hear about the side effects. Watch this video where I break down the top 5 things you need to know about Zoloft.